to inspiring systemic change through. Thank you. Good evening, everyone. It's such an honor and my sincere delight to welcome you all to this edition of the Roundtable WebChat, brought to you by Carecode Digital Health Hub in commemoration of the International Nurses Week. My name is Olateju Sharon, and I will be your host for tonight. Briefly, before I go on, can you please register your names in the chat box and where you're joining us from quickly? Okay, I'm looking forward to your responses, your name, and where you are joining us from. Okay, we'll do that in we can do that in the next 1 to 2 minutes. All right, can we all hear me? If you can hear me, please signify in the chat box. If you can, please do signify in the chat box. All right, thank you so much. Thank you, thank you. Okay, it's about to be an interesting ride tonight as we've prepared seasoned speakers who are experts in their various field of expertise, and they will be sharing with us from their well of wisdom. Tonight, our topic cuts across caring for nurses, leadership, and innovation under the broad theme of caring for nurses strengthens economies. All right. And so today we'll be discussing about how leadership can contribute to the nursing workforce, how innovation can also contribute to the nursing workforce, and finally, how nurses can take care of themselves and how the institution can also cater for their well-being. And I am so definite that you would benefit from this discussion tonight. So it is of utmost importance that you grab your pens and you grab your notepads, you grab your notebooks, because there's so little rather that your brain can accumulate at this time. And as the saying goes, that what you hear, you forget, but what you see, you remember. Okay, so we have three seasoned speakers tonight, and I would be introducing them to us now. On the area of care, we have Alowoja Babafemi, who is a dedicated theatre nurse and MIS specialist. He's passionate about advancing nursing specialties and mentoring new nurses to find fulfilling careers. Babs is committed to empowering the next generation of nurses and believes in exploring diverse opportunities outside of work. He enjoys traveling and personal growth. We have Tijani Mojisola, who would be enlightening us on the area of leadership. Tijani Mojisola is a transformational leadership advocate, nurse, and impact-driven change maker, passionate about building visionary nurse leaders. She currently serves as the program manager at Carecode Digital Health Hub, where she fosters innovation at the intersection of healthcare and technology. Mojisola is also the executive director of Every Africa. Isn't that so amazing? An organization that is dedicated to educating, empowering, and championing community health resilience. She's committed to inspiring systemic change through values-based leadership and intentional action. That's so amazing. And finally, on the area of innovation, we have Oluwatobi Adewumi. Oluwatobi Adewumi is an award-winning healthcare innovation leader, digital health strategist, and mental health practitioner with a proven track record of driving impact across Africa and the United Kingdom. He is the executive director of Innovate Health Africa, where he leads cross-continental teams in designing and delivering transformative digital health initiatives, including the Africa Healthcare Innovation Fellowship, the AI-powered mpox diagnostic tool, pioneering self-assessment platform for digital health capacity building, and lots more. With a round of applause, I want you to gas our speakers with your favorite emojis. I want you to let them know that they are welcome. Could you do that in a few seconds in the chat box? A round of applause for our speakers. We are so honored to have you here. We are so delightful to have you here. We are so thrilled to have you here. And we know that tonight is going to be a swell time. Are you ready? Remember, grab your pens and your notepads. So in case you're just joining us, my name is Olateju Sharon and I'm your host for tonight's section. Please do well to introduce yourself in the chat box and also let us know where you are streaming from. Thank you. So we'll be starting tonight with Tijani Mojisola on the area of leadership. Can we welcome Mojisola Tijani? Could you please unmute your mic? Could you please unmute your camera? Let us see you. Switch on your camera. Let us see your wonderful face, ma. Okay, let's give.
Let's see everyone.
Good evening, ma. Good evening, ma. You are welcome tonight. We are so excited to have you tonight. How are you doing, ma? Okay, we can. Your mic. Yes, your mic. Can you hear me, ma? Okay, let's give her a minute.
Okay, I can hear you now.
All right. Good evening once again, ma.
Evening.
And thank you for joining tonight.
Thank you so much, Sharon.
Thank you. So,
All right.
the question I have for you tonight will be, what does leadership look like for nurses today? And how can we elevate more nurses into decision-making roles? I'll read it again just in case you didn't get it the first time. What does leadership look like for nurses today? And how can we elevate more nurses into decision-making roles? You have the floor, ma'am.
All right, thank you so much. So, firstly, I would like to define what leadership is because, and then compare it with what we think it is today, right? Leadership is the process of influencing the behavior of people towards a particular goal, or in terms of a system now, it is about influencing a system and causing, it's possible to cause any kind of change. But in this case, we are talking about a positive change, right? So, but what it looks like for nurses today, it's almost as though it does not even exist, right? Because and people have different perspectives of how they see leadership in nursing today. Some just see it as a way of filling positions, just being there and just filling positions without them having an understanding of what it takes to do something about that position, to do something in that position, or carrying out the assignment that that position actually requires. For some, it's just like some see it as a waste of time, that because of because of how it has been because of how it has been years back, and people are not seeing the effect of their leadership. They're not seeing the effect of the leaders that they have in position. So most people always feel like it's nothing. So you will go to a random nursing school student and you're asking them, oh, why you ask them, okay, would you like to be in leadership in school, maybe probably the SUD or something, and they're telling you that, well, it's just a waste of time, or they're just being like, they're just nonchalant about it because they just feel like nothing is changing. So far so good, they've been seeing leaders in those positions and they are not doing anything there. They are not satisfying the needs of people. They are not making the impact that they're supposed to make in those places. So a lot of people, younger nurses especially, are beginning to see leadership like as a waste of time. And the effect of that is that we are now beginning to maybe allow other people who are not supposed to lead us. Like, okay, let's just, if we ourselves can't lead ourselves, let's push it to those that can do it better. And that is the reason why you would find nurses in core leadership positions today. For example, you will mostly find doctors in positions of CMDs, you know, MDs and all of that, but no rule actually says that it has to be limited to the profession of physicians alone, or maybe pharmacists or something like that. But over the years, we've just thought to like just push it to them every time, because we don't seem capable on our own. It doesn't look like maybe nurses are capable of leading. Meanwhile, while we were in school, we were taught that one of the roles of a nurse is actually leadership. You often hear a nurse as a leader, a nurse as a leader, but it has been limited to bedside. It has been limited to maybe leading your patient or something, but not in terms of actually making impact. So to the second part of the question, talking about how we can elevate more nurses into decision making roles. All right, I don't want it to sound like maybe I'm answering the question with a question, but I just actually have to say this. Is leadership only just about elevating nurses into decision making roles, or it is about the quality of those who are actually taking the roles? I think we should start to shift our focus towards building leaders, quality leaders who have, you know, the strength, the spirit of leadership, who understand what leadership is and what they are supposed to do, before even saying we want to elevate them into leadership positions. Because what actually determines the outcome of a person being in a decision making role is actually the quality of the person that is actually there. You can just push anybody can fill any position, but what matters is what does the person understand by leadership? Does the person even understand the role that they want to take? Does the person even understand what it means to be in that decision making role? Do nurses actually understand what policy making is? Do we really have that fighting spirit? Because leadership really takes a lot of resilience, and you know, it takes a lot of grit when it comes to trying to make impact. And the fact is, the sad fact is that we already have a system that actually beats out every of these qualities from a random young nurse, you know, right from school. They beat out leadership away from you, such that even the common SUG thing is just like filling positions. Students are trying to advocate for something and they just shut them out. You know, you're not even giving them room to speak. That alone is discouraging. That alone will just discourage the person from even trying to move forward in, you know, somebody who maybe is a born leader and, you know, has the drive for policy making and all of that. A random person who, with all of those experiences, will just give up and will not even bother to say, okay, don't let me even try to rise. Don't let me even do more than this. Anything after SUG, I'm not doing again. Anything after class rep, I know they do again, right? So I think the first thing we need to address is what system are we creating to actually build good quality of leaders, good quality of people who are actually going to fill the important decision making roles that we have, that is important for nurses to be in, right? So, and that actually is my answer to this question, right? Because that is actually what bothers me the most, right? Because if we need to first look at the quality of people we'll be putting into the decision making roles and what it takes to be there before we can even talk about, okay, so how do we now put them there? How do they get there? How do they, you know, be in those positions? Thank you very much.
Wow, thank you so much. Thank you so much, ma'am. Please just appreciate our speaker in the chat box with your favorite emoji. Exactly. Thank you. Thank you. That was very beautiful. And one thing that stood out for me was you talking about leadership is a process of influencing a system. So for some of us, some of the policies that we are not comfortable with, some of the things that we're not comfortable with, and we've all become so convenient with complaining and complaining. There's little to what you can do being at the back. So bring yourself forward, challenge yourself, support the leaders in your vicinity, and helping them, to achieve this change that we want in our environment. Thank you so much, ma. What system are we creating? What system are we creating? It starts from the little things. It starts from you supporting that classmate in your class. We have this way of undermining people close to us when, even if it's our roommate that tells us, oh, I'm going for this position in, and our first reaction is, what do you want to go and do there? I know, and we have no idea of how that little act can kill so much potential in the other person. Thank you so much, ma. Remember, take this home, put it in your left hand. Leadership is what? Is the process of influencing a system. Thank you so much, Nurse Tijani Mojisola. Is Nurse Alo Wajababatunde on the call? So Nurse Babatunde would be enlightening us on the area of care, which is the foundation of strengthening economies. Are you on the call, sir? Could you please unmute your mic and switch on your camera? Thank you.
Oh, yes, I am on the call.
All right. You're welcome, sir. We are so happy to have you here. If you are just joining us, you're welcome. Please do well to register your name and where you are streaming us from. So we are going to be talking about core topics this night, and it will be centered on care, leadership, and innovation. Care, leadership, and innovation. So Nurse Tijani just enlightened us on the area of leadership, and she really did justice to that question. So Nurse Tijani, I would like to ask you, how do you see the role of nurses evolving in the next decade, especially in light of global health and economic challenges? How do you see the role of nurses evolving in the next decade? Nurse Babatunde, are you with me, sir? Okay. Nurse
Okay.
Babatunde.
Okay.
Yes,
Yeah,
sir.
yeah, yeah. I'm with you. I'm with you. Just some network glitch. Sorry, please, can you take that again? I didn't hear the question.
All right. Okay, that's fine. I asked, how do you see the role of nurses evolving in the next decade, especially in light of global health and economic challenges? Did you get my question, sir?
Okay, okay. Yes, I think I get your question now. All right. Once again, thank you very much for. I don't know. Please, am I audible enough? I don't know if you
Yes,
can.
you are.
And I hope that.
Yes, you are.
Okay. So, and there are no noises and just yeah.
Just a little, but we can hear you. We can hear you well.
Okay. Okay, so sorry. Just in the neighborhood, and there are a little bit of noises around. So, all right. Thank you very much once again for having me. It's nice to be here where we have professionals. We're discussing about future trends, care, leadership, and everything that pertains to nursing and all, and pertains to our life and future as well. Yeah, so talking about the evolving of nursing, either present. So we talk about present and future now, right? So a lot of things, have been happening around our profession, and you know, it's good that we're trying to pay attention to all these things. So as to carry each and every one of us along. So there are lots of roles in nursing profession that are actually evolving, and I'm happy that most of us young nurses are resonating to that. Right. We can't, you know, displays the place of technology, which most of us have really, taken advantage of, and we are thriving in that area. Um, AI, we were discussing some time ago, and someone, we had a lecture, a training on robotics, and someone was like, robotics is not fully established in Nigeria, and they are being scared that robots will take away their jobs. As nurses, robots will not take away our job. We should find a way to adapt to the system. In fact, I think it's only one robotic surgery that has been done in the country, and yet we're already afraid of robotic surgery and not taking away. So there are a lot of things. So what we need to do is just to resonate with time. I'm sorry, I can just say, like the children of Isaka, they have the understanding of time. So as nurses, we need to understand what the time is and what is happening at that time. So what we need to do is just to resonate with time, to accept this change. We should not be rigid to change in our professions. So now I will now limit, or I will sub it down to specialties now, right? So we have emergency nursing or emergency room nursing. There are things we can do to make it better, right? We can research into areas where most people have not even researched into. Somebody came into the country, she's a physician and emergency physician, and now, when we start discussing about emergency room, so they have carved out a part that, under emergency now you hear trauma medicine, you hear a lot of things under emergency. So as nurses, we should look for how we do this also to not just saying the umbrella emergency room nursing and all what we do is just running helter skelter. We can just streamline it and look, okay, what can we do to this aspect of emergency room nursing? Okay, talk about perioperative nursing. What can we do now? We thank God that we now have what we call the minimally invasive surgery. Sorry, please, I hope I'm not fast also, and if I'm making sense, I don't know, maybe just some emoji that anybody likes. I hope I'm not too fast. I don't know if we can just show. Okay, thank you very much. That's good. So thank you very much. That's nice. So now, sorry, please, how many minutes do I have again? I don't know if you can just say so I don't just get okay.
You have a minute, sir.
Oh, I've exhausted the time. So let
Yes,
me
you have a
just
minute.
round it up. So what I'm just saying in essence is just that. So we should resonate with time. Just look at your specialty and do something there. I was discussing with one of my mentees today, and she was like, "Oh no, that was yesterday." She was like, she wants to go into OBGY, and people are telling her there's no money there. I said, okay, let's discuss something. This money, this purpose. Which one do you prefer? Is it fulfilling purpose or making money? And she looked at it, well, fulfilling purpose. Then I can tell you, while fulfilling purpose, you can make money as well. But you should do the first thing which will make you happy. Honestly speaking, we all know money can make us happy, especially in nursing profession. We were in a discussion with some surgeons today, and they said you can't make money as a surgeon. That is just the truth, but you can live a better life. But you will be fulfilled practicing that. So, so what we're just trying to say here is just that you can create a room for yourself in your specialty or subspecialty, right, and make it good. Do a research, do something, think outside the box, do something that someone. There are a lot of things I would have loved to say, but maybe when it comes to my time again, we'll discuss it. There are a lot of things, trends in nursing that we have not even tapped into. I can tell you we have not tapped into the future trends in nursing. We are all looking at opportunities, and all what we are just thinking, most young nurses, there's no money in nursing. I want to run out of it. Right. There's money in nursing if you open your eyes, your mind to see it. Right. So thank you very much because of my time. Well, like I said, when it's done again, we'll just say something.
Thank you so much. That was so profound. Can we appreciate our speaker with our favorite emoji? And can we briefly write in the chat box what stood out for you in this section? Thank you so much, sir. One thing that stood out for me was when it resonates with time. Robots won't take away our jobs, and do something outside the box. Don't be complacent. Thank you so much, sir. We're very grateful. Next person we'll have on board is Oluwatobi Adewumi, who would be enlightening us on the area of innovation. Can you please unmute your mic? Good evening, sir, if you can hear me.
Hello, good evening. Good evening, everyone. Good evening, boss. Aloja. I greet you, sir. Good evening, MJ. Good to see you. Good to see everyone. Thank you, Sharon.
All right, good evening. You're welcome. Okay, so the first question for you tonight will be, how are nurses uniquely positioned to drive innovation in healthcare delivery and system design? I'll take it again. How are nurses uniquely positioned to drive innovation in healthcare delivery and system design? Did you get the question, sir?
Yes. Okay.
Right.
Once again, good evening, everyone. And it's been a very interesting conversation so far. Learned a lot from previous answers to the questions. So in terms of answering the question of how are nurses uniquely positioned to drive innovation in healthcare delivery and system design, so there are there are plenty grammars in that question. So let me just make it simple for us. So I think the question is trying to say that why are you, or why should you see yourself as an innovator? Right. How are you an innovator as a nurse, as a professional nurse in the country, in whatever areas of practice you are working? How are you positioned to be an innovator? Why are you an innovator? So the first thing I'm going to say is that nurses, by default, we are problem solvers by default. Right. I know a lot of us might not know this. Every other person has this memo, but nurses alone doesn't have it. We don't know, and we have not realized the fact that by default we are problem solvers. If you go down the history of nursing, I mean, we can streamline it and take it back to just from the time of Florence Nightingale and some other couple guys. They worked together at that time. One of the things that made Florence Nightingale the mother of modern nursing is the fact that she was an innovator, right? She was an innovator. There was a problem on ground. The soldiers, the armies fighting in the Crimean War were breaking down with infections, right? We're breaking down with a lot of, conditions. And there was someone who didn't just see herself as someone who is to dispense medication, or someone who is to dress wound, or someone who is to give injection and those things. She took initiative, and the people she was working with at that time, they looked into the challenge, they looked into the problem. This is unusual. There is something is definitely wrong here. So one might be wrong. That was a starting point. They had to understand and define the problem. What might be wrong? And then they were able to get, okay, something is wrong. They were able to, identify what the problem was. They didn't stop there. They went on to now identifying, okay, what are the solutions? What can we do to make things better? They implemented the solution they came up with, and we could see the results statistically proven that the infection rates or the deaths of the soldiers in Crimean Wars then reduced by something percent. I can't remember the figure in my head. And to be honest, this is what innovation is about. So when you hear the word innovation is not just about, the artificial intelligence, the machine learning, the robot, and that is not innovation, right? Innovation is simply problem solving, right? Or in its simplest, at the background of innovation, what is there is you are able to identify a problem and you are able to sit down, work with people to come up with a solution to solve that problem. So this is what innovation is, right? And like I said, going back to that nurses, by default, we are innovators. Our training, our experiences, in fact, the environment that we find ourselves, say Nigeria now, is a very good, in quote, environment to force us to even be an innovator, because there's a popular slang that says problem not a finish, right? The problems are around us. The fact that you are in the healthcare setting, the problems are there. The problems are there. The challenges are surrounding us. But the fact, if you do not recognize yourself as a problem solver, if you are not seeing yourself as an innovator, even when the problem is staring right in front of you or staring at you, right, just looking at your face, one-on-one, eyeball to eyeball, you won't see it. Right, you won't see it because you are not conscious of the fact that you are a problem solver. So the fourth point, everything I'm trying to say is the fact that by default we are innovators. And then the second thing is that how we are uniquely positioned to drive innovation in healthcare is the fact that nurses have a vantage point in the healthcare system, in the industry, not just the system alone. Nurses have a vantage point in the industry to be able to see problems and provide solutions to them. You know, one of the things we pride ourselves in, I used to say this, one of the things we pride ourselves in as nurses is the fact that we can improvise anything. Right? Like, oh, something is not available, get a nurse, we'll quickly do something, we'll apply that thing, yet it's going to work. It will work. It will do, it might take more stress, it might take more, but do we know that what we are doing at that point is not just improvise, we are actually innovating. If that thing we are doing as improvisation is packaged and marketed to a target audience base, you can imagine, you know, how many thousands of dollars it could generate. Let me give an example. Maybe there's still going to be a question on it, but let me just cite an example. There are two guys in the US. What's their name now? I can't remember their name, but there are two guys in the US. They and I believe that this is a problem that I and you have been seeing every time, right? We know seizure patients, they have the risk of fall, and they have the risk of, you know, hitting their head maybe on the side rails of beds and things like that, right? And these two guys are nurses in the US, and they discovered that they've been nursing a lot of seizure patients that, yeah, seizure pad. Someone has put the name in the chat box for me. So they recognize the fact that, okay, patients are consistently, you know, having injuries from hitting their head on the side rails and all of that. And the initial thing they started doing is that they started padding the metal side rails with pillows. So they will put clothes, they will put pillows just to provide cushion and things like that. Do you know that these guys repackaged that thing they call improvisation into a product, a multi-million-dollar product? Go on Google and type seizure pad. Just go on Google and type seizure pads. This guy, that little thing that I just described right now, which looks like just something, what was that one now? This guy's packaged that particular product into a multi-million-dollar product right now that is selling everywhere in the US. Won plenty of awards, won plenty of recognitions, and not only winning recognition, saving lives. Right? So the point I'm trying to drive at is the fact that as nurses, we are at the center of healthcare delivery at any kind of institution you get to, be it on the ward, be it in the educations, be it in the community, be it offshore, onshore, be it in anywhere you see a nurse. We are always, our role is always somewhere at the center, at the core of the delivery of whatever service delivery in that region or in that setting. So this places us on a vantage point to be able to see what the problems are, to be able to see what the challenges are, and not just only see, we can begin, you know, to think of how can we, you know, solve this problem. But if you do not see yourself, if you do not see yourself as someone who wants to solve a problem, you won't see it. There's a red car theory. I'll wrap up here, Sharon. I know Sharon is already looking at me, so let me just drive this point home. There's a red car theory. There's something called the red car theory, and that theory is let me simplify it. It simply means that if you are standing by the roadside and if you are standing by the roadside and you are just standing neutral, you are not thinking of a red car, and a red car passes, you might not even see that a red car just passed you, right? But if you are standing by that roadside and someone has told you initially that watch out for a red car, immediately that red car comes or shows up from miles or meters away, you would have recognized it. You would have identified, oh, that's a red car coming. So it's just like that. If you have the consciousness that you want to solve a problem, right? If you have a consciousness of being an innovator, a problem, Taufik Gafar is the co-inventor of Seizure Part. So if you have that mindset, if you have that understanding, that orientation that you are an innovator, you would easily see problems. And of course, identification of problems is where innovation starts. All right. Let me stop here. Thank you, Sharon.
Wow. Thank you so much. That was a very beautiful section. And I'm sure I have witnesses in the house that tonight is not just a waste of time, because personally, I'm going back home pregnant. Not with a fetus, obviously, but with a whole lot of solid and valid information. Oh, someone is saying I love listening to him. Okay. Please kindly drop the highlights that you learned from this section in the chat box so that we can all learn from you. And okay, I'll just wrap up and summarize everything that he mentioned, which is innovation is not just about artificial intelligence. Innovation involves problem solving. And if you can't identify a problem, it means you can't be a part of the change agent in your community. Because change comes when you first of all identify that something is a problem, right? Because trust me, you can't say that you cannot identify any problems. There are several problems that do not have solutions yet. They are waiting for you and I, right? So if you cannot identify a problem, join an organization, join a startup that works towards fostering change. All right, thank you so much, Sadewumi. That was so insightful. Thank you so much. Our environment basically prepares us to be problem solvers. Okay, thank you for that, Akobi Teslim. Thank you. So I hope we all know that tonight as nurses, just know you have a gift. And what is that gift? The gift of innovation. That was so insightful. Thank you. The next question would be on the area of leadership. Do I still have Nurse Tijani Mojisola on the call?
Yes.
If you can hear me, all right. If you can hear me, please unmute your mic and switch on your camera. Thank you. If you are just joining us, you are welcome. Do well to register your name and where you are joining us from. Thank you. So, Nurse Tijani Mojisola, I would like to ask you, what barriers do nurses face in stepping into leadership positions, and how can institutions actively dismantle them? What barriers do nurses face in stepping into leadership positions, and how can institutions actively dismantle them? Did you get the question, Ma?
Yeah, yes, I did. Thank you very much. Thank you so much, Sharon. Thank you so much, Nurse Alowolaja and Nurse Adeomi. This was an insightful session. All right, so barriers that nurses face in stepping into leadership position. We actually know them, but I'm going to spell it out to us. But because there are times whereby we may actually know that yes, we have problems, but we are not looking at the root of these problems. One of it is actually the traditional hierarchical structures that we have, right? As much as that is actually not bad in itself, this whole process of hierarchy, there's hierarchy in nursing and all of that. I think at the point it actually got into our heads, right? And we were no longer seeing it as a means of, solving problems and, as a means of a correct form of bureaucracy, but rather as a form of oppression, right? So that's the reason why that hierarchy thing, it really has some kind, I don't know the kind of jazz that thing has, but I want to say it in Yoruba, but I don't want to say it in Yoruba. It used to make us, hierarchy in nursing. You feel, when I first heard that when I got to nursing school, it was like, what's all this was? But it is actually a problem because we do not understand what it is. It has turned to a form of oppression rather than a form of transformation, right? So everybody just wants to be on top, SNO and nursing officer too. When they are supposed to be collaborating and working together, small thing small thing like this, you see SNO saying clarity, NO, nursing officer ṣe mama boo me. You get all this kind. Why will a nursing officer be trying to do something and just unnecessary form of egos like that? And it's even happening among students, right? You see a year one and a year three student bragging about, oh, I came to this school before you, oh, I'm a senior colleague, this, that. But let's look at it actually. What result is it producing? Students will be complaining that staff nurses are doing this to them, but subconsciously even students have started to adopt that method even in the school system, such that it's not easy for you to go and walk up to your seniors and relate, network freely and all of that. Just because everybody just has this pride of I'm a senior colleague, oh, I'm a senior colleague, and all of that. It is not making things easy. It's not making leadership easy. So rather than leadership, rather than the wisdom for leadership and understanding of leadership and leadership in its real sense, the impact of leadership and innovations, problem solving to be in our heads, it is rather ego and pride. And we are just looking down on ourselves and we're not looking at the problems that we really have, right? So that is actually a problem, right? Having a hierarchical structure is actually not the problem. It is very important for the sake of any system. Every system has hierarchy. It's a problem. Yes, I don't know. And I don't know why. Maybe because we don't have other spaces where we get to express ourselves. It's just within the profession alone. So for me, I feel that is the root cause. So people just tend to, um, and just feel like is this nursing? This nursing is able to, like, as if nursing is the only thing that can contain all of them, right? Meanwhile, you really
Nurse Tijani Mojisola, we cannot hear you. I don't know if it's just from my hand. Is it just from my hand, please? So I know I'm not interrupting the meeting.
No, we can't hear too.
Okay. All right. So it's probably network issues. Okay. So what she was saying was that hierarchy in itself isn't the problem. As it provides structure for, every organization that you find yourself, but it shouldn't
all
be
right,
an hindrance in
I'm
fostering
back.
growth. Okay. You're welcome, ma'am.
Thank you very much. All right, so I was saying that hierarchy in itself is actually not bad. It is important for structure in any form of organization, any form of system. But we should not turn it to something that we use it to oppress ourselves and without having to actually think forward, try to solve problems, right? Okay, you are claiming that you are a chief nursing officer. What is your impact as a chief nursing officer? What is the impact? What impact have you been making? What good thing have you done with that position that you are in? Have you been fighting for your system? Have you been fighting for your other colleagues, for your department? All those things, they are very, very much important, rather than just using it to oppress just those in your department that, oh, I'm a CNO now and all of that too. Right? So that is actually a barrier. We need to correct that mindset. We need to begin to understand what hierarchy is all about, that system needs to be transformed, right? I needed to just really talk about this hierarchy thing because it is very, very much important, right? So another form of barrier is actually lack of formal leadership training and development. There's no there are scarce forms of leadership expressions, like, giving platforms and making it easy for people to lead even without supervision, right? I know school I know of schools that I know of schools that even their student union government is being ruled over by their school management. Their school management is talking, is the one that is making the decisions rather than even the students themselves. So you almost wonder that, so what's not the point of the student union government, right? So these little things are those factors that actually discourage young nurses from pursuing leadership roles even while they leave school. you know it's more like a mindset already, right? So also we also have time and resource constraints, right? We are limited in terms of resources and even time. The heavy workload, it will even you won't even want to think about any other thing. You even think about leadership. They even give you a leadership role with the workload and constant fatigue from work, the shortages that we are experiencing, and people being constantly overwhelmed, lacking time and energy, to now exert the energy for leadership. It is going to be very, very difficult. That those All of these factors does not leave room for people to exert their true energy in leadership, their true spirit of leadership, right? So that's why even the hierarchical structure is also affected, because everybody is just tired. They can't do anything about it. So the only thing that they can do is to just rule over their junior colleagues. That's the only thing. That's the best. That's the only energy, little energy, rather than for them to think about, making an impact with the position that they have, right? Also, lack of value and recognition, imposter syndrome, lack of confidence, they beat confidence out of you. The system that we have is such that beats confidence out of you. Nobody cares. Nobody wants to listen to you, right? Also, the gender bias part of it, right? Nursing is a predominantly female profession, and the gender biases can actually exist in leadership selection and promotion processes when it comes to the whole healthcare space as a whole, right? That's why you will mostly not find nurses in certain roles as CMDs, MDs, because um the gender bias, in the sense that men also have their ego. The men have their ego. I know that's why you will see other healthcare professionals just being like, okay, we can't have a woman come rule over us and all of that. But the good thing is just that I love the fact that now, you know more males are being in the profession. We are having more males in the profession, and so there should no longer be an excuse. If anything, there should no longer be an excuse, right? So, so sorry, I think I lost my light here. All right. So, how do systems now create, how do we now correct all of these things? I'm just going to rush this through, right? I'm so sorry for taking so much of our time, right? So, how do we now restructure all of these things? We need to reevaluate and integrate nursing leadership at all levels, right? You know, where a system that does not limit nurses, recognizes nurses as leaders themselves, and just like Nurse Adewumi mentioned, that nurses are innovators, we are problem solvers. When we are now recognized as problem solvers, it is easy for us to break all of these barriers, right? I think that's what I'm actually going to capitalize on. And we also accepting the fact that we are problem solvers and not limiting ourselves to just even the nursing department alone. Start looking at the whole healthcare space and, invade the areas, invade those spaces. Think about problems and think about solutions for them. Don't just be part of those who are complaining and complaining. Be a problem solver. once you are a problem solver, honestly, they will be looking for you to put you in a leadership position. Fact. All right. So I'm just going to pause on that. Right. I'm just going to pause on that. Thank you so much.
Oh, thank you so very much, ma'am. Thank you. That was so insightful. So Nostidani Musala explained how that leadership is meant to be transformational. It's not just lording over people. Leadership is meant to bring out potentials in the other group of persons to be the next set of leaders. So when you see that CNO or that SNO in your various hospitals and it's trying to bully you, quote and unquote, just know that they are ignorant. And it's funny how even the younger nurses are beginning to even lean towards the same set of people that we complain about. So it's always good that there are times that our environment can either make or mar us. So it's important that you reevaluate your values, just like she said. You check yourself time to time. I hope I'm not becoming like the system, because if you become like the system, you just see everything as, and then you do not see a problem with a faulty system. I trust that we've gathered enough information for us to be better leaders and innovators in our environment. So because of our time, please, I will implore our panelists to please the next set of questions so that we can take questions from the house, 1 to 2 minutes maximum. I understand that we are having a swell time, but we should also understand that some of us need to run and attend to other responsibilities. Okay, so the next question will be directed to us, Alowa Jababatunde, on the area of care. Are you with me, sir? Could you please unmute your mic and switch on your camera?
Oh, very well, please.
Thank you. So the next question would be, sir, please, I'm imploring you, 2 minutes. I mean, I won't be able to interrupt you, but you would see with my eyes that I'm internally speaking with you to keep up with the
All
time.
right.
All right. So, what are practical steps nurses can take to improve their well-being? What are practical steps that we can take to improve their well-being? To prevent burnouts, both mental, physical, and all around. That's the total scope of our well-being. Thank you, sir.
All right. Okay. Thank you very much. Well, so practical steps you can take. Yeah. You see, one thing is, I want to remember this word, right? Like you have to don't bite more than you can chew, right? You don't bite more than you can chew. We're discussing lately with one of the managers, and you see people trying to walk from this hospital, they go to this hospital to do local, they go to there. Yeah, it's good. Like I do say, it's good to feel the pulse. When I mean your pocket, but also you take care of yourself. Right. So let's not forget. So one thing you need to do is don't buy more than you can chew. You should. Wow. Thank you very much, Exo. Sorry, Exo is. I'll just say about it. So don't bite more than you can chew. Then you watch out for your well-being wherever you are working. If they are not treating you well, you make sure that you don't stay there. I got a job sometimes ago, and they don't have HMO and all. And so what if I fall sick? Like what do you want me to do? Please, let's whenever you're getting a job offer, read through. I saw someone who was complaining to me, I didn't read through my job offer. I said, then why did you take the job? You should read through your job offer, look at the pros, look at the cons. Not that you're working in, I'm just putting this, you're working in Aja and you're living in Songo. All those things matter, right? They matter a lot. I'm not saying you can't do that, but is it commensurate? You're talking, this is not the time that we need to joke with our health. So they are not paying you well. You don't, I'm sorry. It's not that you can't do the job. You go for interview, they're telling you, yeah, for the start, we'll review your salary. A very big shark in this country, when I mean a very big hospital in this country, they're giving people an offer. And when I read through the offer, I declined. I said, I'm not doing this is not there, this is not there, this is not there. So they're now asking, so why, what can we do? And I spelled out, and they said they can't. Say it's fine, take your job, I can't do it. So we need to look out for ourselves, read through, you take care. So for burnouts, don't where you're working, they're telling you to take care of 22 patients. You can tell them, humbly, I can't do this. Can we employ? If they are not employing and they are trying to add 5K, 10K to your salary, that's not it. So, as nurses, we need to understand, especially now that a lot of things, we don't want to, we are not talking anatomy and physiology. We would have dissected a lot of things that are happening to people, and, we are not paying attention to this. I was somewhere where they want to recruit and we're discussing, and the MD was like, okay, Femi, we want to do this, but I said, sir, this cannot work, Well, Nigerians, we are fond of something. We look at the bulk of the money, we don't look at the bulk of the job. Right. So I told him that truly, yes, sir, I know we look at the bulk of the money, not the bulk of the job. Let us look at the job before even taking the money. Because you don't want to do something where at the end of the day, the money you're making, you're using it to treat yourself. Right. So yes, also we should exercise as nurses, not that we'll be telling people do this, do that, and we're not doing it. But you need to take care of yourself too. You understand? Please, let's take care of ourselves. Let's go for checkup when necessary. Research has shown that healthcare workers are the least users of healthcare. The least users of healthcare. So we should make use of the healthcare. You should go for checkup when necessary. So that's it. In terms of infrastructure, if they're not giving you your place of work, they're not giving you what you need, you should request for it. All right. So thank you very much. I know my time is up. Yeah, I can see. There are lots to say, but because of this, let's take care of ourselves and our work. Right. Thank you very much.
Thank you so much, sir. That was a very relatable section. Don't bite more than you can chew. So this is a message for the rest of us that you juggle different jobs. You jump from one shift to another shift, to another shift, to another shift without resting. This is a message from me to you. Rest. Rest, though. Rest well. Thank you so much, Nurse Baba, today. That was so insightful. Okay, we'll be taking a question. Okay, before we take a question from the house, let me ask Nurse Adewumi. So if you have any question from the house, please, we would not be accommodating a lot of questions, maybe 1 to 2 because of our time. Okay, Extra Diamond, and who else? Just another person. One more person. Okay. So just Extra Diamond. Thank you. So Nurse Adewumi, over to you, sir. Could you please unmute your mic if you can hear me? Thank you so much for staying with us tonight. All right. So my next question for you would be, how can technology be a tool to amplify the impact of nurses rather than a burden? How can technology be a tool to amplify the impact of nurses rather than a burden?
Interesting question. All right. Thank you very much. And so to answer that question, there are a couple of things that needs to be considered to make technology work for nurses and not against them. Right. And the first thing I'm going to mention, which is very important, and from my experience building health tech solution, is that a lot of what we call digital innovation, or all of those apps and systems that we are building, needs to be co-designed and co-created with nurses. Right. A lot of systems, a lot of tools, a lot of solutions have been developed, have been designed for nurses, but without nurses. Right. And that is one of the things that has created a lot of problems with some of the solutions, right? You see the very nice idea, very brilliant. I mean, the solution is really, really needed, right? The solution is valid. The problem they are trying to solve is valid. However, the way that solution is delivered to the target audience, which are nurses, or maybe the user base which nurses are included, is not appropriate. There was a particular, I'll give an example. There was a certain EMR solution that was designed, right, to be deployed in an inpatient settings, of course, where nurses work. There are other healthcare professionals who work there. So this system was designed and it was deployed. Of course, I think it has a 6-month testing period. And the purpose of introducing that new EMR system was to reduce documentation time for healthcare professionals, right? To reduce documentation time for healthcare professionals, nurses inclusive. But when that solution was deployed in actual clinical setting, the solution that was meant to reduce documentation time increased documentation time by more than 50%. And there was a lot of noise, there was a lot of shouting and screaming everywhere, like, what was happening? Bring back. So it was not like an advocacy of bring back the old system. Let's continue. I saw people telling me that I would rather go back to using paper and biro to write, right? And you see, these are the issues. Then we conducted a root cause analysis. There's something called root cause analysis on why that system is failing. And at the background of the roots of the problem, of the failure of that particular solution, was the fact that no healthcare professional was in the team that designed and developed that solution. Just a lot of technical guys who just, of course, I mean, we have software developers and engineers on this call. I can see some of them, right? Technical guys only just want to ensure that your solution is working. Once it is working, they don't care. Is it working? Yes, that's all. That's all, right? So, I mean, just a bunch of technical guys who developed the solution, working very well, and that was it. But in the implementation, it wasn't working. So what I'm saying is, for solutions, for digital health products, and all of that, to work for nurses, I mean, to not be a burden and to amplify the impact of nurses, it has to be designed, co-created with nurses. That's number one. Number two that I'm going to mention is capacity development, right? Capacity development. And I'm going to divide that into two, which I'm going to categorize into self-capacity development and technology-specific or tool-specific capacity development. Now, on the self-capacity development, what that means is that as a nurse, right, you have the responsibility to continuously increase your own capacity in using technological tools. Let me put a disclaimer, right, that the fact that you know how to press TikTok, or that you know how to press Instagram, or that you know how to upload, all of those things, doesn't mean that you are digitally literate, right? Digital health literacy or digital literacy is a whole bunch of discussion on its own. There are nurses who right now does not understand the laws or the regulations or the policies guiding data privacy in healthcare in Nigeria. If you don't know, you are digitally illiterate as far as healthcare is concerned. So when I'm talking about capacity development, I'm saying that you have to expose yourself to this body of knowledge, right, to increase your capacity in that area. And the second part of capacity development, which I mentioned, is the tool-specific capacity development, which means that in your healthcare institution, this is not your responsibility. This is the responsibility of maybe your employer or the organization you work, right? There are certain tools, there are certain systems that are specific to your organization. There are certain machines or engines you work with that you need to learn how to use that particular one. So this is also very important, because if there is a solution and there is no capacity to utilize that solution is as useless as nothing, right? So we have to build capacity to understand the usage and how to actually use some of the solution. Sharon is already in my face, so let me get out. I have one more, but I'll stop it there. Thank you.
All right, thank you so much. Okay, so I'm envisaging that I would leave here 8:15. So please do well to cooperate with me. 8:15 p.m. Extra Diamond, you have the floor. Please introduce yourself with your name, what you do, your question in 30 seconds, and one of the speakers will pick it up from there. And they would wrap up in 1 minute. Please and please, 1 minute, so that you won't see my internal eyes. Thank you. Extra Diamond, you have the floor.
All right. Thank you very much, everyone. Yeah, I mean, I know this session is for nurses. I'm not a nurse, but I joined because I have keen interest in, will I say, health-related field. Two things. One, I want to say thank you very much for organizing this session. It's really insightful. Though I joined late, I wish I joined earlier, but I mean, for one or two things I joined late, but it's been so insightful. Hearing the speaker talk about innovation, I think I can't agree less. But my question, however, is, again, I love the fact that he was able to point out that the innovation is actually not the tools, but your ability to think beyond the box and find a better way to solve the problem. So in recent time, I've discovered that there's this huge disconnect between not just the nurses, but I mean, different professionals, right? There's a disconnect between the nurses and the tech people. There's a disconnect between the tech people and the lawyers. I mean, I'm just trying to see, is there like, maybe because I'm not a nurse, I'm trying to find out, is there like a solution or perhaps an organization that tries to bring people together? And this is why I'm asking this. Why I'm asking this is because I know we have a lot of young talents who are very innovative and they're willing to build out solutions for people. But the problem is they only have the technical know-how. They don't have the domain knowledge. Just like what the speaker, I think, Adeyemi said. He said those, he mentioned an equipment, he said it was built for nurses, but not with nurses. You see, and those are the things we get those kind of problem when it was built without the people there, without the actual user. So there's a huge disconnect, not just for nurses, but for a lot of people. But I just want to understand, is there like is there something that tries to bring nurses and people together? I'm asking because I have keen interest. Thank you very much.
All right, thank you so much, Extra Diamond. So who would like to answer the question from the speakers, from the owls? Please, let's hear you. Let's hear you out.
I nominate Boss Aloja.
Yeah, no. Honestly, okay, thank you very much. Sorry, quickly, Exo is my friend. We've said a lot of things. So interested in collaboration. I would want Nosadeo to please respond because I think he's a tech guy. He's a tech guru. So I think you will flow with him better. I don't know. I don't know if Nosmodusola is a tech person, but honestly, he's a tech. I think you're the one that can answer him better. Just to say. All right.
This is a setup. Okay, so I think what I'm going to say is that I think fundamentally, even within the healthcare industry alone, like the healthcare itself, not to now talk of other industry, healthcare is sort of, there's a bit of disconnect in the industry itself, now bringing other industry in. But I think that recently with the popularity that the things like digital health and health tech is now gaining, there is much more than before. At least I can say of the fact that between 2019 and now, there have been a lot of improvements in the relationship between healthcare professionals and core technical people. There have been, several areas of intersection, right? So I think the thing would be about maybe for now finding that right community that aggregates these guys, right? And I know a couple of them. My organization has a community that aggregate both healthcare professionals, technical people, right? And there are a lot of project, a lot of work that goes on in that. People connect with themselves. I think even as at yesterday, I was still looking for senior software developers that I can work with on a certain project that we are building, right? So yeah, the name of the community, there are two that I'm going to mention. There's a community called Digital Health Africa. The second one is Innovative Health Africa. There's another community called the Youth in Digital Health Network. Right? Youth in Digital Health Network is a community by the Africa CDC itself. So it aggregates not just healthcare professionals, but technical people as well to facilitate those networkings and connection for project collaborations. There's a community called I think African Digital Health Youth Network. So there are a couple of them. I think those are the ones I can remember on top of my head right now. But I'm happy to share a list of those community with maybe Sharon, and then you can find a way to get it across to you, right? And any other person who needs it. So if for anyone who needs that platform that brings together maybe healthcare professionals and technical guys, there are platforms like that, and yeah, it's a really good one. Yeah, yielding the mic. Sharon, you're muted. Sharon, you're muted.
Okay. All right. It's been an amazing section tonight. Okay, I can see some people interested in the link. Okay, so this is what we do. Could someone, a part of the admin, could you please drop probably the community WhatsApp link in the chat box so people can join, and we can forward it to that particular community group? What do we think? Are we okay with that? Because time has gone and we really need to move. So the brand team, the content team can please work on that, and we will wait for them. All right, so with your favorite emojis, can you appreciate with a round of applause our speakers for tonight? Nasalo Jababatunde, who enlightened us on the area of care, Nurse Tijani Mojisola on the area of leadership, and Nurse Adeumi Adeyemi on the area of innovation. All right, thank you so much for that. We are so glad that you are here with us, and we look forward to partnering with you on various occasions that we may have. Trust me, I wish we had enough time because I have a lot of questions that are here. I'm sure you also have a lot of questions that you need answers to, but these people are reachable. You can follow them on their social media platform. Just search for their name, you will see them. They are very popular, very influential people in our community, and these are their names. So once you search for the names, don't worry, their names will pop up. You can follow us on Carecode on all social media platforms at Carecode HQ, on Twitter, on LinkedIn, and on Instagram. Okay, so has the link been dropped in the chat box? I don't know if it has. All right, so if they're having difficulty with that, I want to believe that everyone who is here registered for this section probably to be sent to your mail if we can't do that tonight. All right, so we will be bringing this meeting to a close, and we appreciate everyone that joined us from afar. Thank you so much for making our time to be here. Happy International Nurses Week. Also, you deserve to be celebrated every day. You deserve the medals, you deserve the accolades, you deserve every beautiful thing for the exceptional work you do in the healthcare industry. Thank you for joining us tonight. My name is Olateju Sharon, and I'm your host for tonight's meeting. Good night, everyone. Thank you, Nosadewumi. Can we celebrate our speakers, Nosadewumi, Tijani, and Nosaluboja? Thank you so much for joining us. We are very, very grateful. Have a great night, everyone.
Thank you so much, Carecode, for having me. Thank you so much for the privilege. Thank you, everyone. Have a good night.